Welcome to Therapy Facts with Dr. Jenn. Today we are continuing to talk about the interview between Shannon Sharp and Amanda Seales. Point number 3 is the diagnosis of autism spectrum disorder. So, I had a few therapy fans to contact me and say, hey, guess what? Amanda admitted that she diagnosed herself. And so I thought, this might be the great opportunity to talk a bit more about how autism spectrum disorder is actually diagnosed. It turns out that there are a number of complexities with the disorder itself, which makes it challenging to identify. And then also, many states require specialized credentials in order for diagnosis to take place. So, if one presents themselves to a specialized professional, they may not necessarily be recognized for their symptoms. And so you have to have the spectrum of symptoms, and then you have to have the right clinician in order to be able to get the diagnosis. And so when we talk about autism spectrum disorder, it has only been recognized in the official manual of mental disorders since 2013. That's right, 11 years ago. So the disorder itself has undergone, or the diagnosis itself has undergone a number of changes since it was first recognized in the 1940s. Although it was recognized in the 1940s and categorized under the mental health diagnosis of schizophrenia, it took 40 more years for the diagnosis to become separate and to be considered or called the word autism. So it started off in the official manual of mental disorders in the 1980s as infantile autism, and then it changed to autism disorder. And then 14 years later, in 1994, a version of the disorder called Asperger's syndrome was introduced into the official manual. But by 2013, 9 years later, that particular version of the disorder was no longer present. And in fact, the current version, autism spectrum disorder, was introduced in order to bring together the 3 versions of the disorder that were in the official manual before then. And so there's no wonder with the musical chairs of names and even symptom profiles over the last 40 years at least, that there is some challenge with people being identified and treated for autism spectrum disorder. So when one finds themselves in front of the right professional, assessment of the symptoms of autism spectrum disorder is accomplished by instruments that are based on caregiver reports as well as clinician observation. And so if you are an adult who finds themselves in front of the proper clinician, then much of the report for your symptoms is going to come from you. Now, it's great if you're an adult and you have a parent who can speak to what your behavior was like as a child, because autism spectrum disorder, as I said before, is considered a brain disorder that people are born with. And so if you get to adulthood with your symptoms in front of the right clinician, then you would be talking about symptoms that you've had for your entire life. Now, it is true that family systems can organize themselves around the presentation of symptoms so that there's minimal disruption to the person's lives when they are children. However, when a person becomes responsible for themselves and they no longer maybe have the structure that the family system was able to provide, then the disruption of the symptoms can cause someone to show up to the proper clinician as an adult or an older teenager, because now they are no longer in the bubble that allowed them to function and to get their needs met. When they are now in the position where they have to meet their own needs, it can create the awareness of, hey, something is actually wrong here. I need to do a little more digging. So, as I said, when the proper clinician is found and assessment is done, if it's a child, it is primarily parent self-report or parent report of the child's behavior, and then clinician observation. If you're an adult or an older teenager, you're going to be talking about the symptoms that you experience for yourself, but it can also be helpful for a parent or caregiver to come along to be able to speak to what your circumstances were when you were younger. Now, in terms of diagnosis or even assessment and diagnosis, a person is going to be diagnosed on a hierarchy. So you have autism spectrum disorder level 1, which would be people who have the least amount of symptoms and the least amount of behavioral and environmental disruption. Then you'll have level 2, which are people with the mid-range of symptoms and behavioral and environmental disruption. And then you have level 3, which would be the people who have the most amount of behavioral and environmental disruption. So, who is most likely to be diagnosed? So, within the last 20 years, as we said, autism spectrum disorder became listed in that way in the official manual. So, as you might imagine, people who have the most symptoms are the most likely to be diagnosed, assessed and diagnosed. And so, you would have, even today, the most likely children or people to be diagnosed are children somewhere between the ages of 2 and 3 who fail to meet their developmental milestones, such as crawling, walking, holding their bottle, writing or holding a pencil, being able to color using crayons, to be able to trace letters for their name, to be able to respond to their name, to evidence some desire to interact with other children, and to be able to speak. That's a big deal. Being able to speak. So those children, for children between 2 and 3 years old who have any of those deficits, they are the most likely to become in the presence of, or to seek the presence of the right clinician or the clinician with the right credentials in order to receive assessment. Now, those children, for the most part, are typically on level 2 and level 3. And those children are most particularly white males who have the attention of people who would be aware of the meaning of their deficits and would be aware of the resources to refer them to get what they need. Now, children and adults who are on level 1 are least likely to be diagnosed. People with autism spectrum disorder level 1, which is what Asperger's disorder used to represent, right? We used to say Asperger's disorder, but we don't say that anymore. People with autism spectrum disorder level 1 are least likely to be diagnosed because they are least likely to miss their milestones, to have any deficits in language, have any deficits in intellectual ability, and have any problems with actually accessing school curriculum, which in 1991, school systems began to detect and refer children with symptoms of autism spectrum disorder in order to be able to provide them special treatment or special education if they needed it. So for children who had symptoms of social interaction and communication difficulties that did not rise beyond the level of level 1, then and they were able to access the education, then they would not have been detected, referred, or provided any special education. So then you can imagine then those children who had level 1 autism spectrum disorder would reach adulthood or older adolescence without any intervention or without anyone making any special attempt to get them assessed and diagnosed. So, as it stands in America today, with the recent advent of the diagnosis of autism spectrum disorder and the myriad of changes that have happened over the last 40 years, there's an estimate that there's at least 5 million adults who currently have autism spectrum disorder at any of the levels, but especially level 1, who have not been diagnosed, who have not been assessed, who have not been treated. Likewise, you have the same amount of children, about 5 million children, who have yet to be assessed, diagnosed, or treated as well. What I find is that parents in different sectors can be very reluctant to seek out formal assessments because they hope that their children will eventually grow into or grow out of whatever deficits they have or whatever disruptive behavior they have. However, it is critical, if you don't take anything else from this video today, it is critical for children to be assessed and diagnosed as soon as possible. If you have a child or you know of a child who has delayed language, is not talking and speaking at least 200 words clearly by the time they reach age 2 years old, then go ahead and ring the bell and look for an assessment by a clinician who can diagnose autism spectrum disorder. The reason to ring the bell, even if it's premature, is because the clock is ticking and early detection matters so much. And so if we can get a child diagnosed, assessed, diagnosed, and treated between the ages of 2 and 3 years old, then there is a ton of progress. There's a ton of skill building that can happen that can help the child to close the gap in whatever their developmental deficits, including behavioral, occupational, and especially speech. The longer you wait after age 3, the less likely that those deficits will be closed as much as they could have been had the child been assessed, diagnosed, and started treatment closer to age 2 years old. So, as I said, the diagnosis of autism spectrum disorder itself is very tricky because of the evolution of the syndrome, of symptoms, because of the changing language, and because of the restriction in who can actually do the assessment and diagnosis. But once you get a diagnosis, once you get the assessment, and if there's a diagnosis that comes along with it, there are more and more professionals who are able to provide what we hope is early intervention in order to limit or close up the gaps between where your child is now and where you want them to be. If you're an adult with autism spectrum disorder, there is still assessment, diagnosis, and treatment as well. However, obviously the early intervention piece is past. However, most adults who have not been diagnosed are level 1. And so it is possible to learn the skills and learn the awareness necessary in order to improve your quality of life even as an adult.